Dr. Vrushali Nadkarni. Vrushali is skinologist. Vrushali ji, most welcome. Please come. MBBS झाल्यावर त्यांनी जनरल प्रॅक्टिशनर्स म्हणून आपला प्रवास सुरू केला. पण त्यांचा जास्त कल हा एस्थेटिक मेडिसिनकडे होता आणि त्यामुळे त्या 2004मध्ये काया स्किन क्लिनिकमध्ये कार्यरत होत्या. तिथं त्या कंबायनिंग ऑफ मेडिसिन्स विथ एस्थेटिक शिकल्या, ज्याचा उपयोग ॲक्ने, पिगमेंटेशन, मोल्स, अनवॉन्टेड हेअर्स यावर उपचारासाठी केला जातो. डॉक्टर वृषाली यांचं विजन आहे की त्यांना लोकांना त्यांच्या वाढत्या वयाबरोबर ग्रेसफुली दिसावं यासाठी मदत करणं. त्यामुळे आता यांना भेटल्यानंतर आपण कधीच म्हातारे होणार नाही याची गॅरंटी आहे. त्यामुळे ते सिक्रेट्स तुमचे जे आहेत ते आम्हाला ऐकायचं. योग्य वेळी योग्य प्रोडक्ट जर आपण वापरले आणि वेळेत आपण ट्रीटमेंट आपण घेतली तर आपल्याला मला वाटतं एजिंग प्रिव्हेंट करता येईल असं त्यांचं मानणं आहे. तर कसं ते आता आपण त्यांच्याकडनं ऐकूया. डॉक्टर वृषाली नाडकर्णी.
First of all, good evening. I am very honored today to stand before you as a medical professional dedicated to the field of beauty and healthcare. Okay. So before I start my journey, I would like to give you a quote. It says, "You don't need to be anyone but yourself, and you don't need to go anywhere but here." And I can relate to this every day because patients come to me with a lot of concerns, lot of imperfections. Acne hai, pigmentation hai, blemishes, severe hair loss. And I treat them to best of my medical knowledge. But still I explain them that this is a cosmetic treatment. So you may never get 100% results, right? But whatever life is not perfect, so accept those flaws and whatever you get treated and be happy, okay? And most important, be comfortable with your own skin. Saying this, I would like to introduce myself. My name is Dr. Vrushali Nadkarni, and I started my journey after completing MBBS as a technical trainer and R&D in Kaya Skin Clinic. While working in Kaya for around 8 years, I got introduced to this very new exciting field called as aesthetic medicine. आता aesthetic medicine म्हणजे काय तेच लोकांना माहीत नसतं. So it's basically combining medical knowledge with aesthetics to improve the physical appearance and satisfaction of my patients. Okay, and it's very important because those who don't have would know that, like people have alopecia, that is hair loss from, as old as 10 years and all. Then I started working in Enhanced Cosmetic Clinic, and finally I started my own practice in Parle East. So when I was working in Kaya, one more thing I realized that these services are luxury services. They are not need-based services. It's not a heart surgery, okay? So, but I wanted, because it's duty or right of every person to look good, because they are interconnected. When you feel good, you look good, and when you look good, you feel good, okay? So that's why I started my own practice with a vision of providing these luxury services available to everyone and provide customized solutions as per client's need. Because when I was working in corporate, I'll quickly tell you one incident. One day, what triggered me to start my own practice? One day, the manager came to me and said, "Doctor, patient आया है." I said, "Okay, send her." "नहीं doctor, इतना target आपको आज करना है." And I was just looking at her, I am not here for targets. If needs are there, I'll definitely treat her and give her whatever she requires to pay. It's okay. So that basically made me start my own practice. So now, why skin and hair awareness? Okay, if you see, skin has many functions, including body temperature regulation. I'll not go into detail, protection and all. But if you see the middle picture, Okay, you see that skin and hair are also a reflection of our inner health. Like if a person comes with me, an obese patient with dark neck, he can be pre-diabetic. Or a girl comes to me with a lot of acne on cheeks, hair loss, weight gain, she can have basically cyst in her ovaries. So these all are important, but again, skin and hair are also good. Good health of skin and hair is required because they help in grooming, gives help in personality development and boost your confidence. So these are the services which we offer. I'll not go in detail. I'll give you pamphlets later. But two main categories people come. Okay, one, those who have concern, which I have mentioned, and second category is those who have good skin but they want to maintain. And nowadays there is a chunk of patients who come who never want to age. Okay, and what I explain them is there is nothing anti about aging. Okay, you can age gracefully, and for that, luckily we have now a lot of good FDA approved machines which are safe if used by a skilled doctor, monitored by qualified dermatologist, effective, result oriented, and done by trained therapist. Again, effective and result oriented only if started at the right time with right products and under right guidance. Why I'm saying so? Because during my growth, last 8 years I have been practicing privately, and I would like to share some very important learnings. Okay, one is patients' expectations. I always tell them when they come, कि skin care and hair care is a commitment. If you want to look good, you have to have basic rituals starting from day one. And you need not use so many products, which again the market is bombarded with. You can just start with basic good cleanser, moisturizer, and sunscreen based on your skin type. And the star ingredient here is sunscreen. I always tell my patients, your sun protection factor is your best friend forever. So don't miss it. Second, which I have learned is, thanks to social media, in our field it's really difficult because of Instagram and Facebook. A lot of people come, youngsters come, theli leke aati, they get this bunch of products and then they are getting cosmetic induced acne, they get rashes. So I tell them, you do your work, let me please do my work. Okay? And last and not the least is, it's not fair. I am totally against the game of skin lightening treatments. And I try to do that because when a patient comes, it's okay if they want a brighter skin tone. After vacation, they have tanned and come, then I give treatments. But I strongly refrain them from using these fairness creams. And they use it continually for years, and I've got patients who permanently damage their skin. So I think this awareness is very important, whereas each skin is unique, So you come to me, I'll help you to give you a good, bright, healthy skin tone, which you can just flaunt with minimal makeup and a big smile. You need not use fairness creams at all. So thanks for your attention. And I would conclude my speech with, happiness is a habit and so is your skin and hair care. And I think that's the secret. And addition to it, very important is maintaining your ideal weight. I forgot. Okay? Thank you.
Unanimously decided by the judges that I should be leading these questions. Probably because there's a misconception that it's everything to do with women. I know, so I added to a point probably for you.
Excuse me, it's really not like that. I am really unaware of the things.
Okay. Okay, one pointer is, from my end is, I suppose you need to play a very important role in order to make people understand that it's probably the beauty parlors that are either contributing or creating a more of damage to what the situations are to the individuals. And second most important point, which I feel probably either you have missed out or but it's in the entire your skin tone health.
Yes.
I think it's your diet
Yes,
that plays
yes.
a very predominant role.
Yes.
And that too, the
Yes.
good eating habits from
Yes.
childhood.
Yes.
Is that so?
I forgot
So
to
do
mention
you-
it. So basically, it's the right products. It's your diet, which is 70-80%, your exercise, and that contributes automatically to your weight, ideal weight, and that only helps for your beauty. So the products are external. If you do this internally and you apply minimal products, then I think you can look 5 years younger anytime, but you can't prevent aging at all. And one should never, I think. So that's one of the social awareness I want to create. But of course, some patients, like nowadays, if you know of, because Mail said, nowadays there is a lot of hair loss concern. In fact, in my whole COVID practice, I was dealing only with hair loss patients. But now, technically, the term is male androgenetic alopecia, but you can say male hair loss, But now, I don't know why, but suddenly it has come down to, that day I got 2 patients aged 10 years who have male androgenetic alopecia, and they are being bullied in school. Okay, so it's not only ki, there are a lot of, I think, environmental factors also playing, and now this field is not related only to females. A lot of males also take equally care, because I think grooming has become very important. And if you have good skin health, you don't need not do a lot of makeup or use a lot of products. As ma'am rightly said, if your diet is correct, you're maintaining your weight, and you don't need so much. There's a disciplined lifestyle. So most of my patients come with their mothers, means mothers take them and come, the teenagers, and I have to counsel them more regarding how sleeping habits and, mobile usage and all. Of course, it starts from our home. Because I am a mother of 2, like 24 year, and my daughter is sitting here, 17, so it starts from there.
That's a nice way of disclosing how young you look in spite of your age.
Thank you. Yeah, that was my secret.
Was that the main point in revealing the age?
I think you should be a role model. So that's
Exactly.
why, because
Product
I
sells from
can't.
home.
Yeah, so I can't sit in my clinic and, I'm practicing aesthetic medicine, and then I can't be taking care of my skin or health. I'm not saying skin only. I can't be taken, because if I'm not healthy, my hair fall is going to be there, my skin is going to be worse. So it's all internal and external.
Very, very quickly,
Yeah.
2 questions. I saw minimalism
Yes.
in the slide, so we didn't understand exactly what you meant by that.
Yes.
And secondly, in India, we have a fairness ethos or whatever.
Yes. Yes.
So how do you deal with those, and how do you counsel people on the skin color as such?
Okay. So first question, minimalism, same thing which I was saying, ki nowadays there is a trend. If you see Instagram, Facebook, even doctors promote, I don't know why. And even those who are not doctors, like beauty parlors or whatever, they tell you to apply 7-8 layers of creams in the morning, afternoon, night. And people get confused, what to apply which before, and they waste their time so much on, such things. So, but if you start early, like as I said about the sunscreen. So basically we need only 3 products: a good cleanser, a good moisturizer, and a sunscreen. And as a teenager, if you have acne, that acne cream. In middle phase, if you get little tanned, that cream. And at the end, like after 50, if you want to prevent little bit fine lines and wrinkles, and one anti-aging cream. I think that's enough. So I want to make that as a future. It should be minimal. Why you need? Ek to you are socially also you are creating so much eco, what they call, all plastics and yeah. So I think that's why I
Madam,
tell my patients.
Yeah, no. Now you are basically describing all preventions, like you are prescribing, suggesting few creams. Right now you prescribed. Then you also insisted for disciplined lifestyle. Then
Yes.
as madam suggested, a good diet.
Yes.
So everything is a kind of formula where people can themselves improve their skin tone, everything. Means, is this kind of prevention?
No, but everyone is not just genetically blessed. See, some people, some diseases are genetic. Like suppose acne hai. If everyone had a good diet, they wouldn't get acne. But diet and acne are not connected at all. Acne is a hereditary disease. If your mama or chacha, even parents have oily acne skin, your child may have, or it may skip generations. So if you have like eczema or psoriasis, all these concerns, everyone doesn't have, right? Even if they have diet, they will have psoriasis. So it's not, everything is not related, but diet can prevent it to a large extent. Because simple thing, when acne patient comes, I tell them to stop sugar first thing, because sugar doesn't cause acne, but it stops inflammation. It's anti-inflammatory. Regarding fairness, yeah, actually many people come and ask for skin lightening treatments, and I always tell them ki, that means you're not happy with yourself. You're not happy. They said, no, I'm happy, but I just want to become more fair. I said, how does it help? So they said, because that day only one girl came, and her marriage was not getting fixed in this 23 because she was British complexion. And I told her, okay, I'll give you treatment, but are you working? She said, no, I'm not going to work also because I don't feel like, And I said, what stops? ते कशाला म्हणजे ठीक आहे तुला लग्न नाही जमत आहे, तू 30 वर्षाची आहेस आणि तुझं मुलं आहेत, ती मिळाली नाही. तर मी म्हटलं पहिलं तू कामाला जा, मग मी तुला ट्रीटमेंट स्टार्ट करते, बिकॉज ह्याच्यासाठी खूप पैसे लागतात. रिअली दिस ट्रीटमेंट्स आर कॉस्टली. So then she said, okay, she went, she came, now she's happy. Her skin tone has improved, her colors, actually what happens, stress is also another factor which causes skin darkening. Simple cause, stress. It releases a certain hormone. So you have to counter, so it's not only external, there are so many internal things going on inside. So, okay, thank you.